Good day, ma'am. Our topic is all about postpartum infection. So, I am Mika B. Academia. I am the leader of this group. My members are Abanyo Aiza, Abo Christine, Anke Maricel, and Academia Gianari. So, they will report some parts of this topic. So, introduction. Maternal mortality ratio MMR in the Philippines dropped from 170 per 100,000 live births in 2003 to 114 in 2015. Although this ratio has undergone a slow decrease over time, it remains unacceptably high. The major causes of maternal death in the Philippines are complications during pregnancy, delivery, and the postpartum period includes pregnancy-induced hypertension, postpartum hemorrhage, and puerperal infection. This indicates that many maternal deaths occur not only during pregnancy and delivery but also during the postpartum period. In fact, approximately two-thirds of all maternal deaths occur during the postpartum period. In one study, the utilization of healthcare services in pregnant and postpartum women in the Philippines was observed to be 95.8% and 62.3% respectively. It is possible that a lower ratio of healthcare service utilization in postpartum women may contribute to maternal deaths during the postpartum period. Furthermore, it has been reported that women who delivered at home showed a lower ratio of postpartum healthcare service utilization than women who delivered in facilities. A ratio at home delivers in the Philippines had decreased from 56% in 2008 to 38% in 2013, but it remains still high. Therefore, the provision of healthcare services to postpartum women who deliver at home might be important for reducing MMR in the Philippines. However, there are no reports regarding the outcome of utilization of healthcare services on the health condition of postpartum women who deliver at home in the Philippines. Postpartum patients are frequently discharged within a couple days following delivery. The short period of observation may not afford enough time to exclude evidence of infection prior to discharge from the hospital. In one study, 94% of postpartum infection cases were diagnosed after discharge from the hospital. So, definition. What is postpartum infection? Postpartum infection, also known as childbed fever and puerperal fever, are any bacterial infections of the female reproductive tract following childbirth or miscarriage. It usually occurs after the first 24 hours and within the first 10 days following delivery. So, postpartum infection, it is a bacteria that some mothers develop after giving birth. The contamination happens in the lining of the uterus or the upper genital tract. So this is a microorganism that already be interior of you before birth, or they can enter during childbirth or miscarriage or abortion. So, postpartum infections comprise a wide range of entities that can occur after vaginal and cesarean delivery or during breastfeeding. In addition to trauma sustained during the birth process or cesarean procedure, physiologic changes during pregnancy contribute to the development of postpartum infection. The typical pain that many women feel in the immediate postpartum period also makes it difficult to discern postpartum infection from postpartum pain. It will occur after the vaginal cleaning or cesarean delivery. The contamination takes place, which these bacteria infect the uterus and surrounding areas. So if this bacteria will infect the uterus of a mother, they may feel some pain in their lower abdominal. So, next is etiology or risk factors. The majority of postpartum infections result from physiologic and iatrogenic trauma to the abdominal wall and reproductive, genital, and urinary tracts that occur during childbirth or abortion, which allows for the introduction of bacteria into these normally sterile environments. So in developing an infection after your delivery is different depending on the method used to deliver your baby. Your chance of contracting an infection is the following. These are the chances that some women get the infection or the risk factors. So 1 to 3% in normal vaginal deliveries. Small chances because it is normal deliveries. So 5 to 15% in scheduled cesarean deliveries performed before labor begins. So 5 to 15 chances in getting the infection due to long labors. When the membranes have been ruptured for a long time surgeries, it will the infectious bacteria contact in cesarean deliveries wound, and it will cause a serious infection. So 15 to 20% in non-scheduled cesarean deliveries performed after labor begins. So non-scheduled cesarean deliveries has a greater risk of complications. It can include blood loss, organ damage, allergic reaction to any medication or bacteria. So these are the risk factors of the postpartum infection. Poor intrapartum hygiene. So lack of hand hygiene practices during the deliveries, poor aseptic techniques during labor, and delivery with unclean hands and unclean equipments will have big chances in getting the infection. So low socioeconomic status priority. So low socioeconomic status encompasses not just the income but the educational attainment, not enough knowledge about pregnancy, not or while giving birth or giving birth, financial security, and many more. So prolonged labor. Those mothers who have difficulty in deliveries that goes on for about 24 hours is considered as prolonged labor. Having more than 5 vaginal exams intrapartum. So having a high number of vaginal exams may lead to a higher risk of infections as well as discomfort in intrapartum care. So history of cesarean delivery. So the history of the cesarean section is when the mother must be cut open, when the mother or the baby is at risk. So it is to save the mother and the baby. So next is premature rupture of membranes. So too much stretching the membranes. This may happen if there is too much fluid inside or the baby putting pressure in the membranes. And frequent cervical examinations. So it is a procedure used to look at the cervix, the lower part of the womb, and the top of vagina. It is often done if cervical screening finds abnormal cells in your cervix. So internal fetal monitoring. So monitoring the internal of your body if it's fetal or not. Then pre-existing pelvic infection including bacterial vaginosis. So it is caused by overgrowth of bacteria that found in the vagina which upsets the natural balance. Diabetes. Diabetes can lead to problems for mom and the baby due to high blood sugar during pregnancy. nutritional status. So lack of healthy eating plan can lead to higher risk in getting the infections. And last but not the least, obesity. So obesity can reduce antigen response of a mother, diminished function of natural killer cells due to overweight can cause pregnancy complications. So the next report is all about signs and symptoms will be reported by Academia Gianari.
So, good morning ma'am. My name is GNRP Academia and I am going to report about the signs and symptoms of postpartum infection. So, I'm going to define first what is postpartum infection. So, postpartum infections can be observed in various parts of the body, baggy uterus, breast, and you must watch for them. Whenever you observe any discomfort or an unbearable pain in your body, your first line of action is getting to your doctor. So, whenever we feel like there's something wrong about our body, so our first thing to do is to get to our doctor. So below are the cases under postpartum infection. So here are the following. So perianal abscess. So a perianal abscess is an infection that causes a painful lump in the perineum. So the perineum is the area between the scrotum and the anus in a man. So perianal abscess is a superficial infection that appears as a tender red lump under the skin near the anus. So infection occurs when bacteria gets trapped in the creep glands that line the anal canal. So the bacteria and fluid build up and becomes a lump that is red and painful like a pimple. So if naitaw na maka-experience og perianal abscess kay if mahikapan na niya, so makaingon na siya nga bugas dagay ni nga na, but kuan na dayto siya perianal abscess. So here are the symptoms of perianal abscess. So superficial anal abscess are often associated with pain which is usually constant, throbbing, and worse when sitting down. So di ba kay ang perianal abscess naman na siya sa anus. So if like makalitan tagpungko, di maigo siya, di sakit dyan na siya. So if like mo pungko ka niya nakainganin na infection, so di ka dinangag og pungko nga magpataka nga na. So next is the skin irritation around the anus, including swelling, redness, and tenderness. So, kanang around the infection, kay kuan na siya, nag-skin irritation. So, mara siya sakit nga katul mo rin nga na siguro. And then, gaswell siya and the redness. So, namula-mula nga na. And then discharge of pus. So, then constipation or pain associated with bowel movements. So next is today. So before that, ato sa ipakita tong picture sa dara. So kani sa lower part kay ang perianal abscess. So ingana na siya, mura siya bugas, tender, then mura siya swell mo ingana, gapula siya. So next the diagnosis of perianal abscess. So usually a clinical evaluation including a digital rectal exam is sufficient to diagnose an anal abscess, but some patients may require additional tests to screen for. So like this patient is ganan siya daghan kanang more exams pa screen nga na to identify if naabot jud siya ani. So mukuan siya og sexually transmitted infection. So magpa test siya ing ani if like makafeel siya nga iyahang partner nga basin siguro og kaning na siguro STD or STI nga na. So next is the inflammatory bowel disease. So when we say inflammatory bowel disease, so it is a term for two conditions, so the Crohn's disease and the ulcerative colitis, so that are characterized by chronic inflammation of the gastrointestinal. So next is the diverticular disease. So it is a condition that occurs when small pouches or scars form and push outward through weak spots in the wall of your colon. So magpakuan po ng kuan ani ang patient anang magpa-test po siya ging ani. So para mag-make sure jud siya nga wala ba jud siya kuan perianal nga. So next is the rectal cancer. So rectal cancer is a disease in which malignant, so when we say malignant, so a cancer, so it's a disease in which malignant cells form in the tissues of the rectum. Signs of rectal cancer include a charge in bowel habits or blood in the stool. So like imuhang tai na ay dugo yan na siya. So in rare cases, an examination may be done under anesthesia. The doctor may also ask for an ultrasound, a CT scan, or an MRI. So next is the treatment. So a perianal abscess can sometimes be treated at home with sitz baths or warm water soaked with each towel movement, or at least 2 to 3 times a day. So ang perianal abscess pwede na siya matreat by sitz bath. So ang sitz bath, so it is a type of therapy done by sitting in warm shallow water, and it can help soothe pain, itching, and other symptoms in the anal and genital areas. So makatabang gud siya makasuot siya og pain. Like ang ato ang perianal, diba, kay nag-swell mangud siya. Ngana. So the abscess can drain pus on its own and then heal without any treatment. So pwede po siguro siya nga haning ma-heal without any treatment, but mas appropriate jud if mag sitz bath pud ta kay para pud diba nga less ang pain atong ma-feel. And then so prevention. So in infants and toddlers, frequent diaper change and proper cleaning during diaper changes can help prevent both anal fissures and abscesses. So if naay bata sa inyo so diba pag mapuno na ilang diaper, kinahanglan dyan na siya nga ilisan dyan na siya dayon kay diba may man na sila nga basig mapilasan ba ing ana. So para pa na siya sa mga kanang kuantalay ganing manghugas pud tag atuon po diba kay diba murag lain magud na siya nga watay panghugas unya natay perianal abscess. Hugaw siya pamation. So kanang magkuan pud ta nang mag-change tag diaper sa bata, dapat proper cleaning jud, like makuha ta ng tai nga na ba if ang bata kay nalibang. Yan na. So, next is cervicitis. So, cervicitis is an inflammation of the cervix, the lower, narrow end of the uterus that opens into the vagina. Possible symptoms of cervicitis include bleeding between menstrual periods, pain with intercourse or during a pelvic exam, and abdominal vaginal discharge. So, cervicitis po is cervicitis is an irritation or infection of the cervix. So, cervicitis can be either acute, meaning symptoms start suddenly and are severe. So, like, kuan siya kaning mag-start siya og kaning acute. So, kanang dili pa kayo siya kuan grabe, hantud sa mo grabe siya, or chronic, lasting over a period of months or longer. Cervicitis can result from common sexually transmitted infections including gonorrhea, chlamydia, trichomoniasis, and genital herpes. So, mo ni siya ang picture sa cervicitis. Gaswell, mo siya nana nga gagawas sa kuan cervix. So, symptoms. Illustration of normal cervix and cervix with cervicitis. So, dara ang illustration sa normal cervix o cervicitis kanina sa upper part gani na picture. So, cervicitis causes no signs and symptoms, and you may only learn you have the condition after a pelvic exam performed by a doctor for another reason. This includes large amounts of unusual vaginal discharge, frequent painful urination, bleeding between menstrual periods, vaginal bleeding after sex not associated with menstrual period. So makabalo ra jud ka nga naa kay kuan cervicitis if kanang ang doktor nimo kay mag-perform siya glain nga mga kuan ay mag-perform siya og pelvic exam. So ang cervicitis manggod kay wala na siya ipakita nga signs ug symptoms. So mas makabalo ra ka og kuan ang imong doctor mag-perform og pelvic exam. So mo to siya. Next. So laboratories. So, diagnosis of cervicitis is mostly clinical. However, some laboratory findings consistent with cervicitis include, so, aning na picture. So, first picture, maragod siya ko ibagaswell jud siya, pamula. And then, treatment. Cervicitis treatment usually includes antibiotics to eliminate any bacterial infections that may be causing the condition. So, people under age 25 or who engage in high-risk behaviors may be treated with antibiotics even if bacteria are not detected. Some bacteria can be hard to detect but may still be present. So, ang kanina infection kay ang mga people under 25 ang mojo mga high risk na pwedeng ma-treated og antibiotics. But even if there are no bacteria detected, so moto siya ang sa cervicitis. Next is the AMDNA responsibilities. So Encourage the patient and her partner to verbalize their feelings about the disorder and its effect on their relationship. So, important jud nga ato i-encourage ang atong patient hasta yung partner na ilahang i-verbalize ilahang mga ibati ba. If kanang kuan na patient na ay ani na disorder, if maka-affect ba ni sa ilang relasyon inana. And then next is to help the patient develop effective coping strategies. So as a AMDNA, so atong duty jud is to tabangan ang atong patient na kanang maka-feel po siya better sa iyang kaugalingon even if naapod siya inani na disease. Ato siyang tabangan sa iyang mga gi-face nga mga pag-cope sa iyang mga And then next is if the patient bleeds excessively with menses, monitor for signs and symptoms of anemia. So ginamonitor po nato ang ato ang mga patients if naabot joy excessive na pag-bleed with mens. So kinahanglan na siya i-monitor if na siya signs or symptoms of anemia. So next is to check hemoglobin level as ordered. So maybe as ordered by the doctor po ni siya. And then monitor the patient's response to the therapy. So after the therapy, manguta na kasi imong patient nga unsa naman iyang gibati nga na siya ning nag-undergo siya ging ani nga therapy nga na kanya basig bag na siya puy mga dili pa siya ganahan nga na ba. So next is to explain all the procedures and treatments options. So clarify any misconceptions about the disorder, associated complications and fertility. So before ta maghimo sa kaninga procedure, ato sa juna siya nga i-explain sa ato ang patient o unsay buhaton ingato kay basin niya dili ta mo sulti nila magpataka rata og buhat og procedure niya wala sila na uyunan ba kay wala sila na inform nga inganaon dai sila nga na. Next is because infertility is a possible complication, counsel the patient who wants children not to postpone childbearing. Siya kinahanglan gyud na siyang i-counsel ang atong mga patients na katong kinsang ganahang magkabata ba. So not to postpone childbearing. So next is to recommend that the patient have an annual pelvic examination and a papinacular test. So when we say papinacular test is a method of cervical screening used to detect potentially precancerous and cancerous processes in the cervix or colon. So it is used to gently remove cells from the surface of the cervix and the area around it so they can be checked under a microscope for cervical cancer or cell changes that may lead to cervical cancer. So pwede mo recommend po sa atong patient na mag-undergo og ingani nga test para po ning murutag mo ato silang ato silang like ganing atong silang i-push nga ma'am ingani ma'am mag-undergo lang tag ingani ma'am kay para mas ma-make sure ba nga naabag kay kuan nga na basta niya lahi ang imuhang kuan niya gibati nga na ba. So next is to teach the patient about the adverse effects of pharmacologic intervention. So mato atong duan na tong mga patients about sa mga kuan effects nga na. So next is endometritis. So endometritis is an inflammatory condition of the lining of the uterus and is usually due to an infection. So it's usually not life-threatening, but it's important to get it treated as soon as possible. It will generally go away when treated by your doctor with antibiotics. Untreated infections can lead to complications with the reproductive organs, issues with fertility, and other general health problems. To minimize your risk, read on to learn what they are, the symptoms, and your outlook if diagnosed. So, ano siya? Ang endometritis. So, endometritis is also can be divided into pregnancy-related endometritis and endometritis unrelated pregnancy. So, endometritis typically causes the following symptoms. So, abdominal swelling, abnormal vaginal bleeding, abnormal vaginal discharge, constipation, discomfort when having a bowel movement, fever, general feeling of sickness and pain in the pelvis, lower abdominal areas or rectal areas. So kaniyang picture sa endometritis. So diri dapit sa kuan siya, lining sa uterus. Dira gud siya kalagmitan ng kanang magkuan ang iyahang infection. Even though dili pud siya kuan life threatening, but important pud na treated pud siya as soon as possible. So next is treatment. So bed rest. So bed rest is also important in healing process. And then next is antibiotic therapy. So semi-synthetic penicillin, combination of cephalosporin and metronidazole. And then infusion therapy, so combination of colloids and crystalloids. So when we say infusion therapy, or also called as intravenous therapy, is one way to treat or manage neurological conditions or disorders of the nervous system, and it is used to treat severe or chronic disease and infections that may not respond to oral antibiotics. So ginabuhat po ni siya kay kuan if that certain infection kay dili siya mag-respond og mga antibiotics. And then prevention, you can reduce your risk of endometritis from childbirth or another gynecological procedure by making sure your doctor uses sterile equipment and techniques during delivery or surgery. So para pod ma-reduce ang risk of endometritis from childbirth or other procedures, so dapat ma-make sure nato na ang atong doktor kay nagamit po siya mga sterile equipments or mga sterile equipment and techniques ba during the surgery pod. So Next is your doctor will also most likely prescribe antibiotics for you to take as a precaution during a cesarean delivery or right before surgery. So ang atong doktor pod maghatag po na sila og mga antibiotics nato. So if ang kana nga pregnant mother kay like magpa-cesarean siya, so ginatagaan na siya og mga antibiotics para usa magbuhat og surgery. So next is when delivery is cesarean, prophylactic antibiotics given without 60 minutes before surgery can reduce risk of endometritis by up to 75%. So if kanang mother kanang murag mas ganahan siya kaning cesarean section, so ginatagaan siya og prophylactic antibiotics 60 minutes before the surgery para pod reduce of the risk of endometritis, so mga 75%. And then laboratories. Tests for endometritis may include pelvic exam. So pelvic exam. This is done to check a woman's vagina, uterus, bladder, and rectum. The doctor feels these organs for any lumps or changes in their shape or size. To see the upper part of the vagina and the cervix, the doctor inserts an instrument called a speculum into the vagina. So, ang pelvic exam, so ang kanang doctor na to para ayo niya o check ang ato ang kanang unsa bay mga kanang gipang mga infection. So nana siya isulod na speculum sa vagina, mo na siya use para pag test sa if na ba kay endometritis inana. And then next is the transvaginal ultrasound in this test. So a doctor inserts an instrument into the vagina that aims high frequency sound waves at the uterus. The pattern of the echoes they produce creates a picture. So kanina transvaginal ultrasound kay ni siya kaning ang iyahang ganing echoes sa echoes niya kay makaproduce ni siya picture. So with the use of the echo, ma-picture out manang makahatag siya og picture nga unsay na nitabo sa sulod Then laparoscopy, this is a surgical procedure that uses tiny incisions and a scope called a laparoscope to view the pelvic and other abdominal organs to look for signs and endometrial tissues outside the uterus. So CA125 test, this is a blood test that checks levels of a blood protein known as CA125, which is a tumor marker for certain gynecological cancer, but is also used to detect a specific protein found in the blood of a woman. So ang CA125 test, siya maka-check siya aning blood protein sa lawas sa woman. And then maka-mark po siya mga cancer, mga gynecological cancers na iyahang makita sa sulod sa women. So that's all of my part, and thank you, ma'am.
Good afternoon, Mom. Good afternoon, classmates. I am Christina Blong-Abo, and I am going to report or discuss about the laboratory diagnostic exam for postpartum infection. So since I don't have enough space with my cell phone, so I did screen recording since this is available for me, and I hope mommy understand my situation. So I will explain elaborately with my assigned topic. So laboratory diagnostic exam for postpartum infection. The laboratory studies are directing at elucidating and severity of illness as well as the etiology of the infection. Mild cases of mastitis usually do not require laboratory inspection, and wound infections and infections of the genital tract makes it more difficult to ascertain the extent of involvement. Postpartum infections can be diagnosed by your doctor through a physical exam. Your doctor may take a urine or a blood sample to test for bacteria or use a cotton swab to take culture of your uterus. So these are, I have 7 listed following of diagnostic exams. So first is the bimanual examination. So bimanual examination is an examination, or also known as a pelvic examination of the female genital organs. It is done to check a woman's pelvic organs such as the uterus and the ovaries. The purpose of this examination is to determine the size and nature of the uterus. The healthcare provider inserts 2 fingers into the vagina and then places pressure with other hand to lower the part of the belly. Next exam is the clinical blood count, or the CBC. It is a complete blood count blood test. It helps healthcare providers detect disorders and conditions. The doctor may have CBC as part of the routine in medical exam to review your overall health. Next is the ultrasound. An ultrasound can use as high-frequency sound waves to move an image of a person's internal body structures. It allows your doctor to see problems with organs, vessels, and tissues without needing to make an incision. Next is the thermometry. Thermometry is basically the process of measuring the temperature of a particular material or substance, often through the use of arbitrary but commonly agreed upon scale. So thermometry to determine the body temperature. Next is the vaginal pH testing. It is a vaginal pH testing, or the using narrow range pH paper. It is a quick, cheap, and simple test that can help discriminate between the 2 most common causes of vaginal discharge: bacterial vaginosis and vulvovaginal candidiasis. So this is the healthcare provider should do this test to help evaluate if your vaginal symptoms like unpleasant odor, itching, and these are likely caused by an infection that needs medical treatment. 6 is biochemical blood test. Diagnostic clinical biochemistry uses biochemical knowledge and techniques to assist in diagnosis of human disease, to follow its progress, and to monitor the effect of treatment. It is used to evaluate the functional capacity of several of critical organs and systems such as liver and kidney. Lastly, the hysteroscopy. It is the exam of the inside of the cervix and uterus using a thin, lighted, flexible tube called a hysteroscope. So this is used to this is a manage of a wide range of disorder such urinary tract infection, kidney disease, and diabetes. So that's all with my assigned topic about the postpartum infection. Thank you. Good afternoon, Mom. Good afternoon, classmates. I am Christina Blong-Abo, and I am going to report or discuss about the laboratory diagnostic exam for postpartum infection. So since I don't have enough space with my cell phone, so I did screen recording since this is available for me, and I hope Mommy understand my situation. So I will explain elaborately with my assigned topic. So, laboratory diagnostic exam for postpartum infection. The laboratory studies are directing at elucidating and severity of illness as well as the etiology of the infection. Mild cases of mastitis usually do not require laboratory inspection, and wound infections and infections of the genital tract makes it more difficult to ascertain the extent of involvement. Postpartum infections can be diagnosed by your doctor through a physical exam. Your doctor may take a urine or a blood sample to test for bacteria or use a cotton swab to take culture of your uterus. So I have 7 listed following of diagnostic exams. So first is the bimanual examination. So bimanual examination is an examination, or also known as a pelvic examination of the female genital organs. It is done to check a woman's pelvic organs such as the uterus and the ovaries. The purpose of this examination is to determine the size and nature of the uterus. The healthcare provider inserts 2 fingers into the vagina and then places pressure with other hand to lower the part of the belly. Next exam is the clinical blood count, or the CBC. It is a complete blood count blood test. It helps healthcare providers detect disorders and conditions. The doctor may have CBC as part of the routine in medical exam to review your overall health. Next is the ultrasound. An ultrasound scan uses high-frequency sound waves to move an image of a person's internal body structures. It allows your doctor to see problems with organs, vessels, and tissues without needing to make an incision. Next is the thermometry. Thermometry is basically the process of measuring the temperature of a particular material or substance, often through the use of arbitrary but commonly agreed upon scale. So thermometry to determine the body temperature. Next is the vaginal pH testing. It is a vaginal pH testing, or the using narrow range pH paper. It is a quick, cheap, and simple test that can help discriminate between the 2 most common causes of vaginal discharge, bacterial vaginosis and vulvovaginal candidiasis. So this is the healthcare provider should do this test to help evaluate if your vaginal symptoms like unpleasant odor, itching, and these are likely caused by an infection that needs medical treatment. 6 is biochemical blood test. Diagnostic clinical biochemistry uses biochemical knowledge and techniques to assist in the diagnosis of human disease, to follow its progress, and to monitor the effect of treatment. It is used to evaluate the functional capacity of several of critical organs and systems such as liver and kidney. Lastly, the hysteroscopy. It is the exam of the inside of the cervix and uterus using a thin, lighted, flexible tube called a hysteroscope. So this is used to this is a manage of a wide range of disorder such urinary tract infection, kidney disease, and diabetes. So that's all with my assigned topic about the postpartum infection. Thank you.
Ma'am Estella, good day. So I am Maricel Anki, and today I will be going to explain the treatment and management of postpartum infection, the mastitis treatment. First is breastfeeding. So breastfeeding is the action of feeding a baby with milk from the breast. Breast milk is the ideal food for infants. It is safe, clean, and contains antibodies which help to protect against many common childhood illnesses. Breast milk provides all the energy and nutrients that the infant needs for the first months of life, and it continues to provide up to half or more of the child's nutritional needs during the second half of the first year and up to 1/3 during the second year of life. So in breastfeeding, we should apply warm, moist compress to the affected breast in every few hours, or take a warm shower, because breastfeed in every 2 hours, or we should breastfeed in every 2 hours or more often to keep milk flowing through the milk ducts. So if needed, use a breast pump to express the milk between feedings. So drink plenty of fluids and rest when possible. Breastfeeding positions. So first is laid back breastfeeding or reclined position. The laid back breastfeeding position is also known as biological nurturing. That is often the first mom's try. So if your baby is placed on your chest or tummy as soon as he's born, all being his he'll instinctively work his way towards one of your breasts and attempt to latch on this, known as the breast crawl. So skin-to-skin contact helps stimulate his feeding instincts, while gravity helps him to latch on well and keeps him in place. So this means that laid back breastfeeding is where you to use a comfortable reclined position to feed your baby. It's really a relaxed approach where breastfeeding is seen as a relationship between you and your baby, so with no need to follow a series of instructions. Cradle hold. This is the classic position most of us picture when we think of breastfeeding. It involves you sitting upright with your baby positioned on his side, his head and neck laying along your forearm, and his body against your stomach in a tummy to mommy position. So this in this scenario, you should keep your baby's ear, shoulders, and hip in a straight line. Tuck your baby's lower arm under your arm or under your breast with his or her mouth close to your breast. And then support the breast with your free hand. Place all of your fingers underneath it and well away from the areola. Cross cradle hold. This looks similar to the cradle hold, but your arms switch rules, so your baby's body lies along your opposite forearm. The aim of this is to support your baby around his neck and shoulders to allow him to tilt his head prior to latch. This is a great newborn breastfeeding position and is also good for small babies and those with latching difficulties because your baby is fully supported on your opposite arm. You have more control over his positioning and you can use your free hand to shape your breast. In this type of breastfeeding, you should sit up straight in a comfortable chair with armrests. So bring your baby across the front of your body, tummy to tummy. Hold your baby in the crack or of the arm. And then opposite the breast, you're feeding from left arm for right breast and then right arm for left breast. The side lying position ideal for relaxed night feeds and breastfeeding in bed or on the sofa. Side lying can also be more comfortable than sitting if you had a cesarean or stretches. You and your baby need to lie on your sides next to another belly to belly. So my question is, why should you not breastfeed when lying down? So because lying down position is okay to get started with breastfeeding, but just might turn fatal for the baby as there are chances that milk may get absorbed into the lungs. So secondly, it may also increase the risk of ear infection in the baby if the milk spills from the mouth and reach the ears. So next is rugby ball hold. In this position, also known as the underarm or clutch, you sit with your baby resting along your forearm. His body tucks alongside your side with his feet towards the back of the chair or whatever you're sitting on. So in this, you have to probably need to use a specially designed twin breastfeeding pillow while feeding like this, because especially in the early days. Laid back breastfeeding after a C-section. If you've had a cesarean delivery and can't find a comfortable breastfeeding position, this may help. Reclining with your baby body across your shoulder will let you nurse comfortably without any weight or pressure on your wand, or you could also try side lying. So in this breastfeed position, be sure to avoid weight and pressure on your one side. Upright breastfeeding or kaula hold. In the upright or kaula hold, your baby sits straddling your thigh or on your hip with his spine and head upright as he feeds. You can do this hold with a newborn if you give your baby plenty of support, and it's also a convenient way to feed an older baby who can sit unaided. The upright or kaula hold is often the most comfortable breastfeeding position for babies who suffer from reflux or ear infections. So who often prefer to be upright. So, and it can also work well with babies who have a long tongue tie or low muscle tone. So in this position, this explains that this is easier with bigger babies who can already sit up on their own, while a newborn obviously needs a lot of support from the mother. Dangle feeding. This breastfeeding position involves your baby lying on his back while you crouch over him on all fours and dangle your nipple on his mouth. So this explains that the dangle feeding position allows you to place your baby flat on your lap, dangling your breast over them to nurse. So the advantage of this breastfeeding position is that gravity helps the milk flow toward the nipple and clear plugged milk ducts. Nursing in a sling. It may take a little practice, but breastfeeding your baby in a sling can be convenient when you're out and about looking after older children or even doing light chores. So when an arm sling is in a correct position, the casual piece hand will be slightly higher than the elbow. The base of the triangular bandage should lie at the root of the lateral finger, leaving the fingernails exposed. Double rugby ball hold. The double rugby ball hold, also known as the double clutch, is a great breastfeeding position for twins, as you can feed them in tandem while having your hands relatively free. So kani is for katong twins or kaluha. So you'll probably need to use especially a designed twin breastfeeding pillow while feeding like this, especially in the early days. Supportive measure includes rest, adequate fluids, and nutrition. So because good nutrition can help to reduce high blood pressure and high cholesterol. So the local measures such as ice packs, analgesics, breast support. So in this, a warm compress can help widen their ducts and help the milk come into the ducts in the breast. Cold packs after can reduce swelling. So next, we should administer a penicillinase-resistant antibiotic such as cefalexin, dicloxacillin, or cloxacillin, clindamycin, in penicillin allergic patients. So, mouth and ends up at the back of their mouth against the soft palate. So they lack cell wall receptors for penicillin, greatly reducing the ability of the drug to enter bacterial cells. So what are the best postpartum foods? A postpartum diet doesn't look like remarkably different from a typical healthy eating plan. Fill up on following and you're probably getting most of the vitamins and minerals your baby needs. First, vegetables including leafy greens, bell peppers, broccoli, avocados, carrots, kale, sweet potatoes, tomatoes, celery, cabbage, and carrots. Fruits including citrus, berries, mangoes, melon, apples, and bananas. So whole grains such as oats, quinoa, brown rice, and whole wheat bread. So lean or low-fat protein including fish, poultry, tofu, beans, seeds, nuts, lentils, in the main. So on low-fat or fat-free daily like yogurt, milk, cheese, and eggs. So a healthy postpartum eating plan is a way to go to stave or bone loss. It promotes milk production. Foods that are need to avoid are the following: sugary drinks or soft drinks, junk foods or fast foods or processed food, fish with mercury content, tea and coffee, alcoholic inducing, gas causing, allergic causing foods. This aspiration because when when food or liquid is inhaled into the lungs, it can cause a severe inflammatory reaction or death. So, postpartum diet meal plan. Here's what today of meals might look like. Sa breastfeed, oatmeal with 1/2 or 3/4 cup with a low-fat milk. Then add 1/2 cup of melon for extra vitamins, potassium, and fiber. So in lunch, like tuna 3 to 4 ounces, made with a celery and hard cooked egg for culine on whole grain bread, topped with crispy romaine lettuce, good source of vitamin A, and tomato slices for vitamin C. Note that canned light tuna makes the Food and Drug Administration's list of best choices of healthy and safe fish options. So in dinner, chicken or beef stir fry combined with 2 ounces of meat with 1 cup of veggies such as broccoli, cabbage, red bell pepper, and carrots, along with 1/2 and 3/4 cup of cooked brown rice. Ang snacks keep the snacks into 200 to 300 calorie range for an energy boost between meals. So try low-fat Greek yogurt with frozen berries and almonds, apple slices and popcorn, or smoothie with yogurt, fruit, and spinach or kale. Don't forget to keep drinking fluids. So this all nutrient dense diet full of complex carbs, fiber, healthy fats, and protein plus adequate hydration can help heal your body. A healthy postpartum eating plan is the way to go to stave off bone loss, replenish your iron stores, head off of hemorrhoids, and much more. It promotes, as what I said earlier, that it promotes milk production. So that ends my part. Once again, thank you and have a good day.
Good day everyone, I am Aiza Abanyo. So now, I'm going to discuss how to prevent the infection of postpartum infection. So prevention of postpartum infection, can you prevent a postpartum infection? It's not always possible to avoid a postpartum infection, but there are steps you can take to reduce your risk as much as possible. If you do get sick, seek help sooner than later when the infection is easier to treat, so that you do the action before it's too late, so that the infection might or not getting worse. So by preventing the postpartum infection, first, be vigilant about wound care and cleanliness after delivery. So, wash your hands before touching the perineal area. Wipe from front to back after going to the bathroom. And only use maxi pads, not tampons for postpartum bleeding. Second, know the symptoms and your risk factors. Keep in mind that you're more prone to infection if you've undergone a C-section, especially an unplanned one. And no matter how you give birth, Pay attention to any worrying signs or unusual discomfort. Pain that gets worse instead of better is generally a red flag, so don't ignore it. Contact your doctor ASAP if something seems wrong. The sooner your infection can be diagnosed and treated, the sooner you'll get better. 4. Take preventive antibiotics if they're prescribed to you. Your doctor may prescribe antibiotics if you delivered via C-section as extra insurance against infection. Take each dose exactly as instructed. Contact your doctor ASAP if something seems wrong. The sooner your infection can be diagnosed and treated, the sooner you'll get better. So 4, take preventative antibiotics if they're prescribed to you. Your doctor may prescribe antibiotics if you deliver via C-section as extra insurance against infection. Take each dose exactly as instructed. 4, contact your doctor ASAP if something seems wrong. The sooner your infection can be diagnosed and treated, the sooner you'll get better. Okay, so next, when to call the doctor. You should let your doctor know right away if you notice any signs of possible infection. In rare cases, infections can trigger a life-threatening reaction called sepsis. You should seek emergency medical attention right away if you have any possible symptoms, including fever, chills, clamminess, rapid breathing, rapid heart rate, feelings of confusion, or extreme pain. So even though postpartum infections are rare, the thought of getting one can be nerve-wracking. Be proactive by keeping wounds clean and talking to your doctor about concerning symptoms instead of trying to tough it out. Seeking help quickly is the best way to feel better so you can get back to enjoying your new bundle. So one infection, the incision area in the woman's body, can be infected by the presence of bacteria around these areas. This infection can be recognized by the various symptoms, each as redness, erythema of the incision site, fever, lower abdominal pain after giving birth, etc. So prevention for post-surgical wound infection, many hospitals take these steps to help prevent surgical site infections. Hand washing, clean skin, sterile clothing and drape, clean air, careful use of antibiotics, controlled blood sugar levels, controlled body temperature, proper hair removal. So in mastitis, puerperal mastitis is a regional infection of the breast commonly caused by the patient's skin flora or the oral flora of breastfeeding infants. The organism enter an erosion or cracked nipple and proliferate, leading to infection. Lactating women will often have bilaterally warm, diffuse, tender, and firm breasts, particularly at the time of engorgement or milk letdown. Prevention for mastitis: fully drain the milk from your breast while breastfeeding. Allow your baby completely empty one breast before switching to the other breast during feeding. Change the position used to breastfeed from one feeding to the next.
So I am Mika B. Academia and I will discuss the nursing assistant responsibilities of this topic. So this includes preventing the controlled spread of the infection, promoting healing, and improving the attachment bonding of parent and infant. So here are some responsibilities of nursing assistant. First, demonstrate and maintain a strict hand washing policy for client and visitors. So always keep your hands clean. Always keep your hands washed first before doing the demonstration to the patients. So next is demonstrate correct perineal cleaning after voiding and defecation and frequent changing of peripads. So demonstrate correct perineal cleaning to the patients. Observe perineum or incision for other signs of infection like redness, edema, ecchymosis, discharge, and approximation or REEDA scale. Note subinvolution of uterus, extreme uterine tenderness. Fourth, recommend that breastfeeding mother periodically check infant's mouth for presence of white patches. So in breastfeeding, while breastfeeding a mother to her baby, always check the infant's mouth for presence of white patches. So next, discuss the importance of pelvic rest as appropriate. Next is dutching tampons and avoidance of dutching tampons on intercourse. So next is advise the woman to eat a greater amount and variety of healthy foods such as meat, fish, oils, nuts, seeds, cereals, beans, vegetables, cheese, and milk to help her feel strong and well. So tell the mother to eat healthy foods to keep her strong and well. So next, discuss any taboos that exist about foods which are nutritionally healthy. So discuss to the mother about the nutrition of the foods that will keep her healthy and for the baby. So next, talk to her partner or other family members to encourage them to ensure that the woman eats enough and avoid hard physical work. So always remind the family of the mother and her partner to encourage them to ensure that the mother will always keep healthy, relax, and avoid getting hard work and avoid eating processed food or alcoholic drinks. So that's all for now. That's the end of our report, and thank you.